Hey there, Baby Doc here with some sage advice for expectant parents and newborn healthcare professionals about meconium aspiration syndrome, MAS. Meconium aspiration syndrome, MAS, is a respiratory condition that occurs when a newborn inhales meconium along with amniotic fluid into their lungs shortly before or during birth. Meconium is a thick, sticky, dark green substance composed of cells, mucus, bile, and other matter the fetus has ingested and then expels as stool. Normally, a baby passes meconium after birth. However, stressful conditions can cause the baby to pass meconium while still in the womb due to reduced oxygen supply to the fetus, post-term pregnancy, more than 42 weeks, or placental aging, maternal health conditions such as diabetes or high blood pressure, difficult or prolonged labor, fetal growth restriction or poor growth in the womb, umbilical cord or placenta complications. Signs and symptoms of meconium aspiration are often seen immediately after birth and can include greenish-brown staining of the amniotic fluid and the baby's skin, umbilical cord, or fingernails. Breathing problems such as rapid breathing, labored breathing, or grunting. Cyanosis, low oxygen saturations, poor tone at birth, low APGAR scores. The inhalation of meconium causes breathing problems through several mechanisms. First, the thick, sticky meconium can physically block the baby's small airways. Additionally, meconium is an irritant that can lead to chemical pneumonia, causing lung tissue to swell and become inflamed. Finally, meconium causes surfactant inactivation. Treatment begins right after delivery, where the baby's mouth, nose, and possibly trachea are suctioned by using an ETT and meconium aspirator to remove meconium. Dr. McGlinn has an amazing video on the use of a meconium aspirator. Further treatment depends on the severity of the baby's breathing difficulties and oxygen requirements. In mild cases, the baby may only require close monitoring and possibly oxygen therapy. Yet, with moderate to severe cases, the baby may be admitted to the neonatal intensive care unit and may require mechanical ventilation, oxygen, routine suctioning, and may also need inhaled nitric oxide, surfactant replacement, antibiotics, and in very severe cases, ECMO. MAS cannot always be prevented, but certain prenatal practices can reduce the risk, such as ensuring a healthy pregnancy, obtaining prompt medical attention when a pregnant mother's water breaks and the fluid is greenish or brown, inducing labor as needed for post-term pregnancies. While meconium staining of the amniotic fluid is fairly common, only a small percentage of affected infants develop MAS. With prompt detection and treatment, most infants with MAS have an excellent prognosis and no long-term health effects. Long-term complications are rare, but in severe cases can include chronic lung disease. Be sure to like and subscribe to McGlinn Institute Neonatal and join me, Baby Doc, for more sage advice.